Hello, my name is Viviana Dominguez Ortiz. I am going to talk about acute infectious diarrhea in immunocompetent adults. Definition. Diarrhea is generally defined as the passage of 3 or more unformed stools per day, often in addition to other enteric symptoms or the passage of more than 250 grams of unformed stool per day. On the basis of its duration, diarrhea can be classified as acute 14 days, persistent 14 to 29 days, or chronic 30 days. Gastroenteritis, which is often due to viral infection involving the stomach and small intestine, is associated with vomiting and diarrhea.
Acute diarrhea is a sudden onset of diarrhea, which is typically defined as 3 or more loose or watery bowel movements a day. And acute diarrhea can last for 7 to 14 days, and then it spontaneously recovers, and so the diarrhea goes away.
It can be acute watery diarrhea, or when it lasts more than 14 days, it would be a persistent diarrhea. The main causes of acute diarrhea are parasitic, viral, or bacterial infections.
Interestingly, it can be caused by many different types of pathogens or bad bacteria and viruses, from rotavirus diseases to norovirus to some bacteria like E. coli. So you might have heard of those types of pathogens. There have been over 30 scientific studies that have tested Saccharomyces boulardii, CNCM I745, and they were able to find that pulled together Saccharomyces boulardii is able to reduce the duration of diarrhea by a mean of 1 day, which is a significant outcome. It's effective in adults and children kind of equally, so you can use it with confidence and reliability in both adults and children.
Applications in medicine. Most people with acute diarrhea manage their illness and don't present for medical evaluation. In patients with severe diarrhea associated with colitis or fever, recent or current exposure to hospitals or nursing homes, or the previous use of antibiotic and in patients with persistent diarrhea. Clinical and epidemiology features may provide valuable information in the exam.
How to treat diarrhea. Symptoms of diarrhea include frequent loose stools, abdominal cramps, and dehydration, all of which are uncomfortable for you or your children. Because diarrhea is usually not a serious illness, it can easily be treated at home. You will need fluids, clean hands, and a doctor. Step 1. Treat your child's diarrhea at home by increasing fluids that help replace electrolytes, like sports drinks. For babies, offer them additional breast milk or formula. Avoid plain water, fruit juice, and sodas. Step 2. Continue your child on their regular diet. Step 3. Frequently wash your hands and your child's hands. Keep suspected diarrhea-contaminated areas clean. Step 4. Consult a doctor if your child's symptoms do not improve within 24 hours. Call a doctor if your baby has not had a wet diaper in over 3 hours, has a fever higher than 102 degrees Fahrenheit, is unusually sleepy, has a dry mouth, or has bloody or black stools. Step 5. Treat diarrhea in adults by drinking plenty of clear fluids such as water, broths, and gelatins. Avoid coffee, alcohol, and apple and pear juices. Step 6. Gradually add solid and low-fiber foods such as soda crackers, toast, and chicken. Avoid dairy products, high fiber, and fatty foods. Step 7. Consult a doctor if you are an adult and the diarrhea lasts longer than 3 days, you are dehydrated and have had severe rectal or abdominal pain, bloody or black stools, or a temperature above 102 degrees Fahrenheit. Eating the right things, or getting the right advice from the doctor, will have you back to your regular self in no time. Did you know? Acute diarrhea is commonly caused by consuming food or water contaminated with a viral infection, bacteria, or parasite.
In the pros we have patients recover completely, there are no sequels, very effective treatment. And the cons, treatment may have undesirable side effects.
Today's topic is diarrhea. Diarrhea is an illness in which the body's solid waste is more liquid than usual and comes out of the body more often. Diarrhea is one of the most common health complaints. It can range from a mild, temporary condition to a potentially life-threatening one. Globally, an estimated 2 billion cases of diarrheal disease occur each year, and 1.9 million children under the age of 5 years, mostly in developing countries, die from diarrhea. Causes. Diarrhea can be caused by a virus, such as norovirus or rotavirus, bacteria, such as Campylobacter and Escherichia coli or E. coli, which are often picked up from contaminated food, a parasite, such as the parasite that causes giardiasis, which is spread in contaminated water. These infections can sometimes be caught during travel abroad, particularly to areas with poor standards of public hygiene. This is known as traveler's diarrhea. Diarrhea can also be the result of anxiety, a food allergy, medication, or a long-term condition such as irritable bowel syndrome or IBS. Signs and symptoms. The main symptom of diarrhea is loose, watery bowel motions, stools or feces, 3 or more times a day. Accompanying signs and symptoms may include urgent need to go to the toilet, abdominal pain and cramping, change in color of your stools, mucus, pus, blood, or fat in your stools, vomiting, general body weakness and tiredness. The excessive loss of water in your stool can also sometimes lead to dehydration, which can be serious if it's not recognized and treated quickly. Signs of dehydration in adults can include tiredness and lack of energy, loss of appetite, nausea, feeling lightheaded, dizziness, dry tongue, sunken eyes, muscle cramps, rapid heartbeat. Diagnosis. Besides conducting a physical exam and reviewing your medications, your doctor might order tests to determine what's causing your diarrhea. They include blood test. A complete blood count test can help determine what's causing your diarrhea. Stool test. Your doctor might recommend a stool test to determine whether a bacterium or parasite is causing your diarrhea. Flexible sigmoidoscopy or colonoscopy. Your doctor might recommend one of these procedures to look at the lining of your colon and provide biopsies if no cause is evident for persistent diarrhea. Treatment. Most cases of diarrhea clear on their own within a couple of days without treatment. If you've tried lifestyle changes and home remedies for diarrhea without success, your doctor might recommend medications or other treatments. Antibiotics. Antibiotics might help treat diarrhea caused by bacteria or parasites. If a virus is causing your diarrhea, antibiotics won't help. Treatment to replace fluids. Your doctor likely will advise you to replace the fluids and salts. For most adults, that means drinking water, juice, or both. If drinking liquids upsets your stomach or causes diarrhea, your doctor might recommend getting fluids through a vein in your arm or intravenously.
Issue applied in Ecuador. People that suffer from acute infectious diarrhea in Ecuador are more likely to have this disease by eating contaminated food in place with loose sanitary resources. Conclusion. Mechanism of acute diarrhea according to the infecting should be studied to look for new treatment targets. Anti-secretory drugs are being prepared, but the way of diarrhea for which these physiological treatments would be appropriate aren't known. It is important to make people aware of the consequence of not receiving correct treatment. Thank you.